Now we are going to hear from Mary Holt Pallone, who is a clinical nurse educator and the mental health specialist at the MDA ALS Center of Hope at Temple University in Philadelphia, Pennsylvania. Mary holds a master's degree in counseling psychology and has worked within the fields of neuromuscular and neurodegenerative diseases since 2005, supporting patients and families, facilitating support groups, connecting resources, and educating communities and fellow healthcare providers for improved quality of life. She has also focused much of her career on the role and study of stress as it relates to health and chronic medical conditions. She has a private coaching practice specializing in mindfulness and stress management and develops mindfulness programs for various companies, schools, community, and healthcare organizations. Mary also has 2 children, a very happy dog, and loves running, great pizza, the beach, music, and nature. So, Mary, thank you for being here. I think a lot of us right now are feeling very stressed with not just the environment and the pandemic, but I think the stress does exacerbate all of people's symptoms too when they're not feeling that well. So thank you for being here today.
Yeah, thank you, Nicole. Absolutely, I agree. I mean, I've definitely seen it in my own life, and definitely with those that I work with. Let me just share my screen here. So, yes, I just want to say, let's see if people can see. All right. So I just want to say, yes, a huge thank you to MDA and Nicole for having me here, and a huge hello to Texas, of course. Coming from Pennsylvania, it's a bit rainy Saturday here, which actually we've needed for quite some time. So, of course, yes, we're going to talk about neuromuscular disease. We're going to talk about stress. And then mindfulness. I'll do a little bit about mindfulness in and of itself, just a kind of little introduction, which has been and continues to be a wonderful tool for some people. And of course, since this is 2020, I would be, severely remiss if I did not mention stress as it relates, or the pandemic as it relates to stress in our health. So we'll talk a little bit about that as well. I do also want to say that, yes, for the last 15 years, I've worked with, I want to thank Dr. Khan just mentioning this kind of interdisciplinary treatment and management for neuromuscular diseases and neurodegenerative diseases. And I have had the great fortune of being part of a interdisciplinary, multidisciplinary team with the MDA ALS Center of Hope. And it's just been a wonderful experience. And I started as the nurse coordinator there and then moved into the mental health role probably about 8 years ago. So it's a great privilege for me to be here today. All right, so let's just talk a little bit about, let me see if we can, now my slides aren't shifting. Huh. Okay, well, yeah, actually, okay. Can people see that?
It's a blank PowerPoint slide. We did see your presentation. We see that.
Can you see it now?
Yes.
Interesting. Okay, so I'm not sure how we got so far here. Technology. Okay, let's see. All right, thanks. Okay, great. So here we are. So let's talk a little bit about, yes, just stress in general and neuromuscular disease as it relates to stress. So, yeah, so among, various factors, there's actually, I have to say that stress has not been, there is some data and some studies that have been done in terms of research in neuromuscular diseases, but it's not a huge amount. So that is something that I would love to continue, helping to move forward in terms of the research around this. And, what I've pulled from over the years is just some of it is stated here. So that, psychological stress affects both mental and physical health. I mean, I hope that most of us know that. Studies do indicate that there is, this bidirectional association between psychological stress and cardiac stress, cardiac risk factors, which is, a huge concern for people with neuromuscular diseases and muscular dystrophy for sure. So what that bidirectional means is that if one exists, so if there's psychological stress, the incidence of cardiac risk is present as well, that one affects the other. And definitely, patients with muscular dystrophy are commonly afflicted with psychological disorders, that are listed here, and that likely exacerbates disease progression and worsens quality of life. Now, I myself, I've worked in this population for 15 years. I do not in any way, shape, or form know personally what it's like to live, excuse me, with a neuromuscular disease. I do have a chronic condition that I will have for the rest of my life, and stress significantly impacts that. And it was not until a number of years after being diagnosed with this condition that I actually really started to take account of, how the stress and my mental health affects my physical health, and being able to incorporate things that help me manage stress in a better way has significantly benefited my physical condition as well. So we will talk more about that as well. And also too, that, stress has been observed to be one of the leading causes of some neuromuscular diseases that occur or diagnosed later in life. So let's just talk a little bit about what exactly is psychological stress. It's different from stressors. So stressors are those things that happen in life. They could be positive, they could be negative in terms of how we perceive them. So stressors are the things that happen in life, to us per se, that sometimes we have control over, sometimes we don't have so much control over. And stress is actually a normal response for the body. It's a normal response to events that really, events that potentially make us feel threatened or imbalanced in some way or unsettled. It can also be the result of physical stress and vice versa. So what I mean by physical stress in that, or what they are referring to in physical stress, meaning, say, if my body is injured in some way, that's a physical stressor. This is just an example. And then I can have a psychological level of response to that. Psychological stress is also described as a factor that creates bodily or mental tension. I know for myself, I get incredible tension. So just, somewhat paying attention to yourself, or your body, just kind of taking inventory for yourself as we go through this as well. Pressure or strain, of course. And then this is a really important down here at the bottom. The level of stress that we individually experience is really based on our own perception appraisal. And, what that means is, how is it that I am thinking about this thing that's happening? So I'm perceiving it as a threat in some way, on whatever level that may be. And, I also may feel like, this may just be too much for me to handle. So I really want to, kind of drive home this idea that, the psychological stress really is based on our perception, our own perception. And the reason I want to drive that home is because that is actually something that we have control over. We might not have so much control over what's happening, but we do have some control over what we're thinking about what's happening. So I'll talk a little bit more about that. Okay, so let's just talk a little bit about the body. The body, okay, under kind of, I'm going to say normal in quotes, normal conditions. So, sometimes stress absolutely does get a bad rap. And I myself thought, all stress was bad, and it's actually not. It does serve as valuable information. When we can become aware of when our body is getting activated in whatever way that our body tries to tell us that can be a really helpful thing to help us understand that, oh, maybe there's something here that I need to pay attention to. So it can serve as valuable information. And it's actually, it is a primal reaction. It is hardwired in us, this kind of stress reaction that we have needed as human beings. We would not have survived this long as a species if we didn't have this certain, protective mechanism inside of us. So, and I do use this example often, but, when the caveman came in contact with that saber-toothed tiger way back when, and there's a picture here. I mean, you can see what this guy's doing. He's kind of somewhat frozen in fear, which is understandable. One of three things happens. So there's a saber-toothed tiger, we come in contact, the caveman comes in contact, and the brain, we perceive this as a threat, which is understandable. The brain instantaneously starts to get into action, and all sorts of neurochemicals and protective neurochemicals and stress hormones are activated through the body. So we respond as humans in one of three ways: fight, flight, or freeze, right? I'm going to fight my way through this. I'm going to totally shut down and freeze, paralyzed, or I'm going to get the heck out of here, okay? So there's all sorts of things. Blood rushes out to the main muscles, away from the stomach, and other, things that are not needed. So this is an inbred mechanism that is protective for us. Okay? So let's just look at the kind of physiologic changes in the body. And this is not a full list, but of course these are some of the main things. So what we can see here is that, the body perceives a threat, all those neurochemicals start rushing, all sorts of things start happening in the body to protect us. Heart rate increases, blood pressure, all these things, muscle tension, blood clotting, sweating, adrenal, like the adrenaline, adrenal release, all of these things increase. Then we have the digestive functions and the immune functions. And I know we're not, we can't kind of talk back and forth right now, but usually I ask people, digestive functions and the immune functions. So our immune function, our immune system, I'm sure many of us know this, is there to help us fight off illness, fight off disease. So then if our immune function, if we're continually in this cycle of stress upon stress upon stress upon stress, our immune function can really become depleted in lots of ways. So then it can't help protect us as well as it could. So we really, really want to be mindful of these. And then I'm going to show this slide in a different way a little bit later. And digestive functions, really important for all sorts of things, our gut, especially, that our gut is really, we're finding, especially in a lot of neuromuscular diseases, that is a really important function, and holds a lot of important mechanisms in terms of the brain function and things like that. All right, so this slide here shows a little bit about this kind of phenomenon or progression, right? Now, the body is built, our human body is built to handle acute stressors, okay? So this is my little stress to distress to disease or dis-ease, okay? So that we have repeated stressors, and we may or may not have an outlet, and it may be an outlet that maybe isn't so productive or effective or healthy per se for us. And then there can be increased stress. So we have repeated stressors plus, no outlet, or maybe a not so productive outlet for the body can equal increased stress, which then can equal distress, where I can have some of these symptoms, like frequent hyperarousal of the body system. So I have higher blood pressure, things like that, internal. So there's an internalization of the stress reaction. So meaning that these neurochemicals are getting fired throughout my brain and my body, and these hormones, stress hormones, and there's no kind of outlet for them. So it becomes internalized, which then kind of beats back at the body, right? And then there can be this dysregulation or imbalance. Either it can be outward, in terms of my emotional state or whatnot, and it can also be in some physical symptoms, and then also internal as well, some physical symptoms, stomach upset, inability to sleep, increased physical symptoms like, headaches, pain, increased pain, anxiety, heart arrhythmias, things like that. Then there can be what we call chronic hyperarousal. So this process continues, and then there can be dysregulation, disease, dis-ease, right? So where I work with people and our medical team and our whole multidisciplinary team is we all kind of work together in collaborating. How is it that I can help support the person with the illness and the family as well in terms of psychologically managing stressors, coping, things like that. So then the other modalities that the other team members are bringing in can really serve as optimally as possible. And then, if we have this chronic hyperarousal, there can be worsening of pains, physical symptoms, prolonged illness, or other illnesses and disease, physical, mental, emotional breakdown, maladaptive coping. And I have to say, I did find, before what I shared with you guys, before I really started to make some shifts in terms of my mental health, I did find myself, further down on this list. So, symptoms of stress, and I probably don't even have to, have a slide on this. We're probably all aware, but maybe we're not, so I just want to identify, and of course, this is not exhaustive as well, but, we can have memory and concentration problems, feeling anxious, there can be physical symptoms, of course, feeling overwhelmed, moodiness, irritability, GI and bowel problems. And that's for sure, remembering that our GI system can really be affected by our stress, increased fatigue, all sorts of issues, trouble sleeping, all sorts of things. So we just want to be mindful that if we're seeing any of these things, out of the norm, that are different maybe than, some of these could come along with also the kind of neuromuscular disease that you may be living with, or your loved one may be living with. So this is something maybe above and beyond, or it seems exacerbated, or anything like that. So then, just thinking about, wow, what's chronic stress? And that is really where this is a prolonged period, right? There's emotional pressure suffered for a prolonged time. And again, this idea of perception, right? Where the individual perceives he or she may have no or little control. Right. So there's this whole kind of endocrine system response with neurochemicals. And this last part I do want to kind of bring or make a point of too. It's while the effects of these stress hormones are beneficial in our immediate for acute stressors, remember it's protective, that can be helpful. Long-term exposure to these stress hormones can really create, havoc. And over time can, lead to high blood pressure, damage to muscle tissue. So if we already have a muscle disease, we want to do everything we can to not then increase the potential of that continuing damage or increased damage. So the immune system, of course, and then of course damage to our mental health overall, quality of life for sure. So I did mention this a bit, but I do want to really support and identify that our bodies are really incredibly resilient and amazing, and quite miraculous. So it is built to tolerate these acute phases of stress. And there's this process that is also built into the body, and it's known as homeostasis. And our physiologic body really, this homeostasis is really the desire and the mechanisms built into the body to come back to a balanced state where, the blood pressure comes back down, the heart rate comes back down, the neurochemicals like cortisol, the stress hormones like adrenaline, norepinephrine, those things are all they all down regulate, and they come back to a balance within the body that is manageable for the body to tolerate. So this state, this mechanism of homeostasis can get out of balance as well. So what can happen, and that is necessary for us, this, especially those with neuromuscular diseases and neurological conditions, there can be this autonomic system dysfunction within the body that can interfere with the body's ability to kind of come back to a balance and come back to the state of homeostasis. So just to be mindful of that it's even then more so, and this is not to put more on top of everything that you're already living with, but how much more beneficial it can be if we do pay attention to the stress in our life and how to manage that in an effective way, and giving our bodies an opportunity to kind of release in whatever way we find the stress. Okay, so now this is a part of inventory, because of course I have my body and my life, and I'm the kind of conductor of the train in some way. So taking inventory in terms of what's my relationship with stress, now in my life. So these are just questions that I always pose to lots of my clients. I use these questions myself a lot in my own life. So it's about taking inventory. Now, these questions are not, of course, all the questions that you could ever ask. They're just some that have been helpful for lots of people that I've worked with. And I offer to a lot of my clients and patients, what are the current stressors? How does stress affect me physically, emotionally, right? Mentally, how does it affect me? What's my reaction, my response to it? How do I react to stressful situations? How do I cope? And is the way that I'm coping, or various ways that I'm coping, are they helpful? How do they affect me, right? So if I'm feeling stressed and I choose to go out take a walk, or just to sit outside and, or if I choose to pause, there are things that all could potentially help me. If I choose then to maybe, avoid it, or who knows, take a drink, or of alcohol, or whatever it may be. I'm not to pass judgment or anything. I just have an opportunity to look at, like, how is that serving me? Is that helping me? Do any specifics of my condition make me more susceptible to stress or interfere with my coping? So, in neurologic and neuromuscular diseases, there can be some cognitive involvement. So really looking at, do any of these, or any other, am I more prone to depression or anxiety? And do any of these make me more susceptible, right? And how can I then modify and really bring in appropriate tools that will help me then cope effectively? What patterns of thinking cause me stress? And that's a big one for people. That's a big place that I really do a lot of work with people. These patterns of thinking that kind of add to the stressors. What helps me calm down or relax can be really helpful to identify. What would I like to change, if anything, about the ways that I cope, or my relationship with stress? So these are just some of the questions that can be helpful for people to begin identifying, where am I on this track? Right? Okay, so now what? So now I have this information. Now what do I do with it? So then we make a plan. Okay, and I usually help people make a plan if they're open to that. So, or you can make a plan yourself. So how then can I manage? What is it that I'd like to change, if anything? Maybe I find out that the way that I'm coping or anything like that is wonderful for me and really helpful. Is there anything that I'd like to add? So, and these are all ways to kind of process stress, physically release stress, the stress hormones and things like that. So exercise, movement, range of motion, OT, PT, like regular movement can be really helpful for the body, just to release. So these stress hormones and neurochemicals don't get stuck and just sit there in the body, kind of, wreaking havoc sometimes, silently. So another place that occupational therapy can be really helpful is if there is cognitive involvement. If there's some people that I've worked with have a higher sensory level of tolerability, or a lower sensory level of tolerability. So occupational therapy I work closely with our occupational therapists in terms of being able to find modalities and techniques and tools that are really helpful for people individually, based on their particular condition. Or diagnosis and symptoms. Building and using a social support and a care team. So hopefully your doctor, your healthcare providers, your team, if you do have a multidisciplinary team, hopefully they are a supportive system for you. And then if there is a limit, if you're feeling limited in terms of your support system, I always encourage people, support groups, just expanding that network of support, maintaining, adopting a healthy lifestyle. Now, that means everything from, my mental to what I'm putting into my body, so nutrition, all of these things in terms of movement, everything, this healthy kind of, lifestyle, the things that I'm doing. Finding outlets for, journaling, writing, therapy, movement, even just dictating if hands are involved. Gaining control over what we can, of course. And granted, these are processes, easier said than done, a lot of them, but they can be achieved, in small ways, bigger ways. Increasing joy, laughter, and positivity. I mean, there's a ton of research in terms of, how medicinal laughter can be, right? So if we're laughing, if we're, feeling joy or gratitude, positivity, they actually produce neurochemicals in the brain also, and healthy, healing neurochemicals, right? That are not necessarily, that don't break down as, like the stress hormones do, that can be detrimental in some ways. So increasing these things in any way that we can is super great. getting out in nature. Getting out in nature is huge. Finding ways to relax, calm, pause. All right, so let's just mention this a bit, and I realize our time here. So here we are, 2020. Yes, we are in the land of a pandemic and all sorts of other things. So I just really want to honor this state that I think for everyone is just unsettled, very unsettling. There's a lot more isolation that we're seeing, all sorts of things. So the CDC even states that anybody with underlying health conditions can respond differently to the stress related to COVID-19. So fear and worry about your own health, loved ones, increased isolation, decreased access to care and resources, change in routine. 1 week we're doing this, the laws are changing, the regulations are changing, routines are changing, you can't have people in the house as much, all sorts of things it's a continual loop of transition. Worsening of chronic physical conditions and mental health conditions. And then we're definitely seeing an increased use of, maybe not so effective coping. That's certainly what we're seeing in the mental health realm. Specific suggestions around pandemic stress is, following the CDC guidelines for sure to keep ourselves safe and others safe. Knowing what to do if you start to feel sick. Taking breaks from exposure to news, stories, and media, gosh, if you can. I know that has greatly affected me. Talking to people that you trust and who also support you. So hopefully your medical team is part of that. Engaging as much as possible, virtually, if that's an option for you. And then, of course, utilizing the general stress management tools as well, some of them that we mentioned already. All right, so I'm just going to kind of briefly introduce, or people might already be aware of mindfulness. It's quite the buzzword. I just want to mention what mindfulness is and just some ideas about it, because it can be a really kind of spot right in the moment, help me kind of get more grounded. So it is present moment awareness. So it's basically, in a nutshell, paying attention on purpose in the present moment without judgment. That's pretty much it. Paying attention on purpose in the present moment without judgment. And that's usually the hard part, without judgment, because sometimes I don't necessarily like what is happening in the moment. And a lot of times my own judgments and opinions create much more stress for me as well. So it disengages the automatic pilot too. We become less reactive. It's conscious living, making conscious choices around really everything, potentially, if we choose to. It's meeting what arises in any moment with openness and acceptance, right? Imagine that, meeting like the world today with openness and acceptance. Wow. It's a tall order. So it's cultivated through paying attention on purpose, through meditation and other techniques as well. And the word cultivated, it doesn't happen overnight. It is something that over time gets cultivated. So why be here now? Especially if maybe we don't like so much what is happening in the moment. But this really is the only moment that we have to make any effect. This. And I can tell you from being in mental health for quite some time that, and from my own life, that 99.999% of anxiety and stress is related to past and future focus. So if we can bring people back here and really ground ourselves, then that can be incredibly helpful, right? Most just stress is created from past and future focus. We have little control over what happened in the past and what's going to happen in the future. So the freedom of our mind really happens right now. So these are some proven benefits of meditation, of mindfulness meditation. Down regulates the physical body. It decreases pain, depression, anxiety. And there are studies and research upon research on this. You can look at any of them. Some of you might already be aware of it. Improves attention, focus, and sleep. We become less reactive. It boosts immune function. Super great. So it relaxes the body. It helps regulate blood pressure and blood sugar levels. It increases the gray matter in our brain around the areas of emotion regulation, memory, learning, empathy, and it allows that stress to disease become, stress awareness and freedom. Okay. So these are the physiological changes. This is that other slide. So I just want to mention to everyone, so you can see it here. All of these, the first 8 lists here that were all increased in the last slide, these all decrease with relaxation. That is a good thing. And then our digestive functions and our immune functions increase when the body is in a state of relaxation. That is super great. And there are things that we do have some control over, that we can affect change in. So I don't want to go too much into this. I realize our time. Informal mindfulness practice, I just want you to know that there's informal practice and then there's formal practice. Informal practice is really about being conscious in my everyday life. When I'm showering, can I just have my mind be in the shower, not thinking about 18 other things, right? So time and time again, my mind goes off, I bring it back into the shower. I use my five senses. I'm going to talk a little about that. Create pauses in my life purposely to become more aware. Check in using my breath and the five senses. Something called relaxing sighs, where I take a nice breath in and then I slowly breathe out. I let my exhale be a bit longer than my inhale. And the breath is a big piece of this. And I just want to mention for people that, because I work with a lot of people that have respiratory and pulmonary issues, and their breathing is not normal per se. I use that lightly. So we do lots of modifications, and we're able to do that. So these are things that I just want to offer to people, that, pausing more, just check in with yourself. What is my body physically feeling? What is my mind thinking? How's my breathing right now? Am I becoming stress activated? What do I need to do? What am I thinking, feeling? Can I change the situation at all? Can I change my reactions? Yes, I can. I can change my thoughts, right? Staying in the present moment, using our five senses can be a quick doorway into coming right here, right now. So if I just notice, if all of us just take a minute to notice, how does it feel? What do we feel in this moment? Physically, do we feel ourselves wherever we're sitting or standing or whatever we're doing? Do we feel the feet on the floor where the hands are resting? That can bring our mind right here, right? What helps me calm, feel balanced, right? This is formal meditation practice. Most of the studies that are done, the research studies, are done around formal practice. And that's meditation practice, where you actually carve out time here. The formal practice, you carve out time to meditate, sitting, walking. It's really kind of a control of the mind in a sense. It's more focusing of the mind. The mind goes off, it comes back. We refocus and we refocus. And there's a great thing. A lot of people say to me that start meditating. I teach meditation, I teach mindfulness, and they say, my mind just goes all over the place. And they think, and I thought too, that I had to clear my mind. That is virtually impossible to do, just so you know. So trying to empty the mind of thoughts is like trying to empty an ocean of its water. There's no need to do that. All we need to do is simply focus and refocus. I'm focusing on my breathing. I'm focusing on a sound. My mind starts to wander. I simply bring it back to the sound that I was focusing on, or the breath, whatever it is. Now, certainly in 2 seconds, that's a lot to take in. I can, there are resources. So there are resources. What are our takeaways? Our mental health. I hope everyone knows that our mental health is just as important as our physical health. One affects the other and vice versa. That's how it goes. They are an interplay, interwoven all the time, forever. We may not have control over what is happening, but we absolutely do have control over how we respond to what is happening. Please know that we do have control over that. There are things that can help you find ways to manage that. MBSR, mindfulness-based stress reduction, is one. These are some of them: counseling, psychotherapy, and coaching. They can all be helpful resources to find ways. Mindfulness meditation apps, there's a ton of them. I've just listed a few. Virtual support groups. I want to let everyone know that I have started, during this COVID period, I've started an online virtual, via Zoom, support group for neuromuscular diseases. Muscular dystrophy, mitochondrial disease, CMT, whatever it may be. It happens the first Tuesday of every month at 6 o'clock Eastern time. So if anybody wants information to that, please let Nicole or myself, you can get a hold of me and let me know. And I'll certainly give you the link. The Center for Disease Control during this time, and certainly nature, yoga, Tai Chi, all sorts of things. So that's it for me. I'm sorry, I think I went a little bit over, but yeah. Thank you so much. I will continue to be a resource for people if you need it.
Thank you, Mary. I know I downloaded a meditation app on my phone, and it's self-guided. And for me personally, that's helped me because I don't know how to meditate. And so having that app that, is at your fingertips, and you can designate if you want 2 minutes, 5 minutes, 10 minutes.
Yes.
because we're busy and you don't know how much time you have, but it's amazing when I'm done with that. I do feel better. So I'm definitely a fan of that.
Super great.
um,
Yeah, so there's tons of apps they can be really helpful. Yes. Mhm.
and we had a question that had came in regarding that, and they have such a hard time getting started with mindfulness practice. And what tips could you give her to try to keep mind calm? And I definitely think meditation is one of those. Do you have anything else to add?
Certainly. So one of the things that I give to people just in the very beginning, and something that I tried in the very beginning when I was just starting, is was using my five senses.
Hmm.
So it was the two things, the check-in and the five senses. Well, actually three things. So checking in, which is the pausing, and then using my five senses to really ground me. Whether it be just, I'm focusing on what I'm seeing, what I'm hearing, smelling, and then also the breath, if that's possible, using the breath, taking a breath in and a breath out, just because that physiologically downregulates the body. When we exhale, we breathe out carbon dioxide. That is a good thing. It helps oxygen flow to the brain. It down regulates the body. So the breath, so it's pausing, checking in, five senses, and breathing.
Hmm. Um, is there a way to make sure that if someone is seeing a mental health practitioner, or whether it's just being a therapist that they see on maybe a every month basis, not necessarily an every week basis, is there a way for those folks to keep communication open through their mental health therapist and their GP or their neurologist?
That's a great point. Absolutely. And I'm a huge advocate for that.
Okay.
Anytime that I'm working with someone from the mental health standpoint, outside of, say, our clinic, I
Hmm.
will also, and now of course I have to have my client or my patient's permission, but I will
Sure,
always
sure.
offer to speak with them, any of their healthcare providers, so then we can collaborate to serve that person best.
Exactly.
100%. And oftentimes I have to say that it does fall on the responsibility, whether this is sad, fortunate or unfortunate, the responsibility of the people living with the illness or the condition to advocate that for themselves, to
Hmm.
really, because that is the nature of healthcare right now. Many practitioners don't talk to each other.
Exactly.
So you being empowered and advocating for yourself enough to bring those two pieces together is huge, if you don't have a multidisciplinary team.
Sure, sure. I am not seeing anything else. Someone typed in great tips. Thank you. It was a great presentation. I know I could relate to a lot of those things as well, and it's nice kind of knowing that we're all not alone. We're kind of all in this together right now. So, and all the information was great. Thank you,
Wonderful.
Mary.
Yes,
Have a
thank you
great
so
rest of
much.
your weekend.
You too. Thank you so much. Take care, everyone.